I'm Dr. Julian Willoughby, and today we're talking about PRP. For the right patient population or someone who's been struggling with a nagging injury where steroid injections haven't worked, PRP has been a tremendously helpful treatment. I really tell my patients to think of it as like a microsurgery. I'm going in and I'm addressing small parts of the tendon with a tiny needle. Start to finish, we have a plan. The patient comes in, they get their blood drawn. I will use two different types of PRP, leukocyte-poor versus leukocyte-rich. We've figured out what type we're using. It gets run through a machine for about 20 minutes, which extracts all the platelets. That gets handed off to me in a syringe, and then usually I've already got the patient on the table ready for their procedure. Every procedure that I do with PRP is image guided, typically with ultrasound or fluoroscopic x-ray, because it's so vitally important that the PRP be put in the exact right places. Then they basically rest for 2 weeks, and then we start the therapy process. Let's say you've tried a steroid injection in your hip or elbow because of pain, and it helped for a short period of time, but then it wore off. That's one of those things that's classic for a tendinopathy. We've learned that steroids help pain, but they actually make the tendons damaged more over time. And so if you've been getting a steroid injection repeatedly in the same location for months, or every 3 months you keep getting a hip injection and it works great and it keeps coming back, that's the kind of person that PRP might break that vicious cycle of repeated steroid injections. And so it's the right kind of therapy with the right kind of PRP done in the right way where we've seen big results, and that's where we can really help people in the long run. One of the misconceptions, however, is that it just fixes you and it doesn't require any effort on your part. All of the research that's been done on PRP usually has some type of physical therapy along with it, because we're jump-starting your body's healing process, and doing that therapy helps continue that healing process. One of the other things that's really important to know is that your HSA money can be used for PRP. So go online, give us a call, just say you're interested in PRP, and we'll take it from there.